Hi, my name is Viviana Dominguez Ortiz. I am going to talk about Apixaban to prevent venous thromboembolism in patients with cancer. Definition: Apixaban is an anticoagulant used to treat and prevent blood clots and to prevent stroke in people with atrial fibrillation. Specifically, it is used to prevent blood clots following hip or knee replacement and in those with a history of prior clots. It is used as an alternative to warfarin and does not require monitoring by blood test.
Patients with cancer have an increased risk of venous thromboembolism, but parenteral thromboprophylaxis is not routinely recommended in practice guidelines because the absolute risk reduction is modest and parenteral thromboprophylaxis is associated with an increased risk of major bleeding as well as the inconvenience of daily injections. Could a direct oral anticoagulant such as Apixaban, used as a thromboprophylactic agent in patients with cancer, offer advantages over parenteral agents, particularly with regard to convenience? The randomized placebo-controlled double-blind AVERT trial included ambulatory patients with cancer who were at intermediate to high risk for venous thromboembolism with a Corona score of 2 or more. The Corona score has been validated to identify patients with cancer who are at elevated risk for thromboembolism. The trial patients were randomized to Apixaban for thromboprophylaxis before chemotherapy or to placebo before chemotherapy. The primary outcome was objectively documented venous thromboembolism over a period of 180 days. In a modified intention-to-treat analysis, venous thromboembolism occurred in 4.2% of the 288 patients in the Apixaban group and 10.2% of the 275 patients in the placebo group. The number needed to treat to prevent venous thromboembolism was 17. The main safety outcome was major bleeding. Major bleeding occurred in 10 patients in the Apixaban group and 5 patients in the placebo group. The authors conclude that Apixaban at the initiation of chemotherapy resulted in significantly lower rates of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer. The rate of major bleeding episodes was higher with Apixaban than with placebo. Full trial results are available at nejm.org.
Application in medicine. To lower the risk of stroke and embolism in people with non-valvular atrial fibrillation. Deep vein thrombosis prevention (DVTs) may lead to pulmonary embolism in knee or hip replacement surgery patients. Treatment of both deep vein thrombosis and pulmonary embolism. To reduce the risk of recurring deep vein thrombosis and pulmonary embolism after initial therapy. Pros: Apixaban prevents more strokes with fewer side effects. Apixaban for reduction in stroke and other thromboembolic events in atrial fibrillation. Cons: Apixaban can increase the risk of bleeding, which may be serious and potentially fatal. When spinal epidural anesthesia or puncture is utilized, patients who are being treated with antithrombotic agents for the prevention of thromboembolic complications are at risk for developing a hematoma, which can cause long-term permanent paralysis.
Some of the things that I think are going to be really exciting about the rollout of these guidelines are that since the last guidelines were published, we now have 4 new drugs that are available on the market for people to prescribe, and we don't have any guideline information about how to use those. And so one of the things that was really exciting for our panel is that we are able to dig in and try to make some recommendations about how to use those drugs in the treatment of people with venous thromboembolic disease. And it was really exciting, but it was also challenging because the drugs are new enough that a lot of the information about questions that people are grappling with, there might not have been as much evidence, but the really great thing is in the room in the panel discussing this were the experts and the people that really have their finger on the pulse of what's going on out there clinically. A novel thing about these guidelines is that the plan is to continually update them as much as possible in real time. And so I think our panel will get the opportunity to add additional information, and as new drugs come onto the market, there's many that are in the pipeline right now. We'll be able to add to the recommendations that we've made and continue to inform people about the optimal use of anticoagulant drugs.
Issue applied in Ecuador. In Ecuador, Apixaban is used for therapeutics of heart failure in older adults. Other application is for stroke prevention in non-valvular atrial fibrillation in public healthcare sector of Ecuador. Conclusion. Apixaban is a direct selective factor XA inhibitor for the prevention of stroke in patients with atrial fibrillation and for the prevention of VTE after knee or hip replacement. The drug was found to be superior to warfarin in clinical trials in preventing thromboembolic events in patients with atrial fibrillation and an additional risk of stroke. The most common adverse event of Apixaban is bleeding, although the bleeding frequency appears to be similar to that of warfarin. The potential risk of major bleeding is lower with Apixaban. Apixaban therapy resulted in significantly lower rate of venous thromboembolism than did placebo among intermediate to high-risk ambulatory patients with cancer who were starting chemotherapy. The rate of major bleeding episodes was higher with Apixaban than with placebo. Thank you.